Hi, my name is KyleeJensen. My topic is going to be on muscular dystrophy. I'm going to explain what exactly is this type of disease. It's a type of genetic disease and it reduces muscle mass, making a patient feel weakness in the muscles. I included a picture right there. It shows normal biceps with a healthy person that does not have muscular dystrophy, and on the right shows a patient with muscular dystrophy, and you can tell in between the biceps it just looks more weakened or inflated as the picture kind of shows. And just an overview of what I'm going to be talking about in my slides is the etiology. What causes this condition? How does it happen? The demographics. Who is more likely to get this disease? Is it men or women, children, etc.? I'm also going to talk about the anatomy. What organs in the body are being damaged or harmed by this disease? And I'm going to talk about physiology. How do the organs function when damaged or harmed, and the types of symptoms that may happen when a patient has muscular dystrophy? I'm also going to talk about diagnosis. How is the disease identified? Is it through blood work? Also going to talk about treatment and artificial intelligence. How can it be cured and helped? All right, so with etiology, muscular dystrophies, they're muscle infections that are grouped together, and they're caused by damage in a DNA gene. The longer someone has muscular dystrophy, the muscles just become weakened over time. So the longer someone has it and is not cured, the weakness just gets more and more worse over time. Also, how can someone get it? There are 3 different ways that muscular dystrophy can be passed down genetically. First, we have autosomal dominant, and this is when a child receives a normal gene and a defective gene from both of the parents. And then second, we have an autosomal recessive gene. Just means that both genes are defected by the parents when they're passed on. And then we also have an X-linked when it's passed down. It just comes from the mom's gene, which is defected. It passes to the son or daughter. And this kind of also goes with the demographics, because males are more prone to getting the disease than females. And that is because the mom is passing down the X chromosome. And when a daughter has that X chromosome, one is defected and one is not, and the one that is not is from the dad. So it kind of balances each other out to where the daughter may not have muscular dystrophy, or it might not be as bad as the male getting it, because when a male gets it, it only has that one X chromosome. And then going along with more demographics, muscular dystrophy is familial, so it just runs in the family. It's just genetic. It can affect many different muscles throughout the body. It really doesn't matter on the person's age. It depends on the type of disease that someone may have. They can be affected from birth, or they can be affected maybe from age 10, 11, 12. Just depends on the type of disease. But for example, I included Duchenne muscular dystrophy, and it affects about 1 in every 3,500 to 6,000 male births every year in the U.S., that is a lot. And I included that example with males because males are more affected by this disease. And also with demographics, I included this picture. It includes all the countries on the x-axis, and on the y-axis includes the number of patients. And as you can see, France has the highest, along with the USA, has the highest number of patients, which is probably about, I would say, where it's at, probably like 5,000, maybe 6,000 patients, which is a lot of patients. We also have Russia, which is exactly at 1,000 patients. There's just so many different countries that it ranges from, but almost every country is affected by this disease. Next, we have anatomy. Muscular dystrophy can affect many types of muscles throughout the body, and there are over 600 types of muscles throughout the body, so it can affect so many different kinds. There are so many different kinds of muscular dystrophy to talk about. Just some type of muscles that can be affected are the heart, the central nervous system, eyes, the biceps, triceps, quadriceps, etc. There's just so many to name, but yeah, I don't want to name them all. Also with anatomy, I love this picture because it shows a whole muscle and what it is made up of. And what it's made up of is the bundle of muscle fibers, and what it has inside of it is a muscle fiber membrane, and what's inside that muscle fiber membrane is proteins, as you can see on the bottom where the arrow's pointing. And also you can see the dystrophin, and the dystrophin is where the muscular dystrophy happens. So the dystrophin enters with the proteins in the muscle fiber membrane, and it links into that muscle, which the picture is just a great example of explaining it, and it also kind of goes with the physiology of it. It is genetically passed down from the X chromosome, and every patient dealing with muscular dystrophy, they always experience weakness because that is what the type of disease it is. Weakness in the muscle is just caused by that dystrophin linking into that muscle fiber, and as it sits there for long periods of time, it just gets worse over time. Some symptoms, I included like the top 3 muscular dystrophies just because there's so many, but a couple symptoms for all 3 of them. They all do include muscle weakness. With Duchenne, it also includes falling. Walking becomes problematic and just difficult. Feeling exhausted, and calves may appear larger than normal, than the average. Also with Becker disease, includes the muscle weakness. It also may include like walking on your toes, difficulty lifting objects, heart and breathing complications, and also the calves are larger than normal. Also, with Becker muscular dystrophy, the pelvis, shoulders, the thighs, the hips also weaken. With congenital muscular dystrophy, it blocks the joints from moving. It can cause scoliosis, deformities in the feet, respiratory issues, problems swallowing, a weak diaphragm, seizures, possibly problems in vision, and also causes speech troubles as well. And there may be more symptoms along with it, but there are so many different types, and each patient can be different as well. For diagnosis, there's several ways to diagnose muscular dystrophy, also depending on what it is, but there are physical examinations. Sometimes you may be able to just see it in the patient. There are blood and urine testing. There is genetic testing if, maybe your mother had it or your father had it. You can just do a genetic test. There are also diagnostic imaging like MRIs, X-rays, or CT scans. There are muscle biopsies, electron microscopy, and immunofluorescence, which can be looked at through a light microscope. For treatment, also depends on the type of muscular dystrophy, but treatments can vary from ventilators. That can just help with breathing issues, breathing problems that someone may have. There are also drugs and medications that someone can take, which are corticosteroids, or we have immunosuppressant steroids. Those help with the weakness in the muscles. There's also physical therapy that a patient may do. It just keeps the muscles strong, doing different types of exercises that keep a patient moving all the time. There's also occupational therapy, just learning new movements that someone may be doing on an everyday basis, like learning how to write again, learning how to walk again, just basic things. There's also speech therapy. There are muscles in the jaw that may affect a patient that might need some speech therapy. Diet improvements help out a lot. Just with any type of disease, I think it's always great to improve your diet, and then there's also surgery as well. And lastly, we have artificial intelligence. Artificial intelligence is just, another word for it would be machine learning. There are different types of instruments that can go into further details and diagnose a patient more accurately and faster. So I found an article, it was from a company at Copenhagen Neuromuscular Center's Department of Neurology. And what their machine learning was, it was a MRI that they created, and it does an examination scan. And their result came out to be 95.7% efficient. So with an average MRI, points-wise, an average MRI scans from a 31 to a 42 range. And with their artificial intelligence scan, their points were 55. So it was a lot more higher, a lot more accurate. So artificial intelligence is definitely being used with muscular dystrophy and helping patients today. And here are my resources that I used, and also my picture resources as well. Thank you.